and at times frustrated by a healthcare system that has its challenges, to say it sweetly, is oftentimes just considered broken. And the thing that's making me encouraged tonight is that in the midst of that frustration and pain, I feel some encouragement by what I hear tonight. But we're all here because we know that medical costs have been out of control. And we've heard that we have a healthcare system that's both expensive and complicated. We took a year trying to understand this system, and we're not all there yet. It's complicated. However, even with that being the case, I do have good news. Because along with the Commonwealth of Massachusetts, we actually have an opportunity to fix the system. The greater Boston medical industry may be spinning out of control, but there are two new powerful entities in town whose task it is to rein things in. And our job, GBIO, was twofold: to help these entities do their job and to hold them accountable to doing their job. And we're going to hear a little bit more about them in a bit. But after hearing from these chief executive officers, we can now better understand what contributes to some of the complexity of our healthcare system. You see, at times, and even from some of the comments I heard, at times it sounds like each of the institutions and organizations can function sort of in isolation. There's difficulty sometimes crossing over and working cooperatively as opposed to competitively. But like any other healthy corporation, I understand these companies want to survive and thrive by preserving and protecting and strengthening the position in their market, in this market, and I understand that. But in order to really move to where we want to be, lower cost, high quality care, and less frustrated pediatricians like myself, we have to figure this out together as a team. And that's a lot of the reason why we're all in this room together. The two new entities that I'm talking about were created really with the new cost containment law in mind. And they are CHIA, you've heard. And if you speak Portuguese, that means auntie, as many of my patients speak. But the Center for Health Information and Analysis and the Health Policy Commissions. It is their job to connect these systems, to have these distinguished guests join hands together in this fight, to demystify the system, and to rise above the fray to determine actually what is not best for each of these organizations, but what's best for the whole state, what's best for you and me, for us. And we thank God for these new state agencies, quite frankly. We hold them up in prayer because they have a hard job ahead. We hold them up in prayer as they work on behalf of the Commonwealth to reach our cost containment and quality of care goals. And those two goals run together. And at this time, we'll actually have the pleasure of hearing from the leadership of CHIA and HPC as they explain how they are going to approach this formidable task. And I'd like to take time now to introduce Mr. Aaron Barros, the Executive Director of CHIA, and he has been asked to answer the question you see on, I believe, your green sheets of paper, and to my left.
Thank you, and good evening. So I want to